So hello, everyone, and welcome to Bowen for Beginners. We are so excited tonight to have our colleague Irma Barron, who is extremely active in the Bowen community. I am Dr. Annalyn Schooley, current chair of the Florida Interest Network, and we have several other board members here, Danielle, Richard, and of course Irma herself. And Irma, please give us a quick introduction of yourself, and let's get this workshop started.
Okay, well, welcome everyone, and I am very, very pleased to do this presentation. I have to thank my professor at Nova, Dr. Chris Burnett, for introducing me to Bowen theory, and I never looked back. So I really, really use this theory in everyday life, and during crisis like this whole pandemic, I hold on to it more than ever, and it really does help me make sense of the world. And so I've been at the university, at Albizu University, Miami campus now for 20 years. I used to coordinate the family therapy program over in the master's program, and then I recently joined the PsyD program, and I'm thrilled to be able to teach family therapy there. And actually, I had my class today with my students, so and they're all excited about doing their whole family genograms, the family diagrams. And so I know that in the literature we talk about genograms, but just so that you know, the Bowen people don't call them genograms, they call them family diagrams. And that was always a debate. So whenever I lecture, I always say genograms, aka family diagrams, or vice versa, just so that you know that. I am an advisory board member to the FFRN, which is the Florida Family Research Network. We're the South Florida Consortium. Our board members were all trained under the late Dr. Bowen. And they're very, very active in the community. And we're looking forward to bringing in an international conference in 2 years. But as soon as I get more information, I'm going to share our annual conference next year that we're going to be having, dealing with parenting issues and child abuse and neglect. So it's going to be a really exciting conference. So I will give you that information. But basically, so enough of me. Let's talk about Dr. Bowen. And so, you know, Bowen Family Systems always views the family as an emotional unit. And so the easiest way to remember this is if you can remember, I'm going to date myself, but remember Play-Doh? Remember just a glob there? If you can visualize the family as a glob, and then because it's an emotional unit, and I don't know if you can see the little cartoon there showing everybody together, and then really looking at the reciprocal functioning and then the actions that comes through it. And so really what individuals do is out of this glob is then when they start to individuate or differentiate. And they're still part of the emotional unit, but now they're starting to develop a sense of self and identity. So that's an overview. And then in Bowen Family Systems, we look at nature because we are animals. We're part of the animal kingdom. And so anything that's observed in nature is seen as natural. And so that's how the Bowenians make sense of how we operate by looking at other species on the planet. Next slide, please. So the late Dr. Murray Bowen, he was a psychiatrist, and what he did was at that time was quite extraordinary, if not revolutionary, where he started to want to treat families, not only the identified patient, not only the psychiatric patient. And he received a lot of pushback where he was in his medical training, but he stuck to it. And I think that part of that Bowen theory was that he stayed in a very non-reactive manner, and he plowed through, and he started to treat families. And he had received a wonderful grant out of the National Institute of Mental Health Research. And what he did was he hospitalized the schizophrenic patient, the IP, along with their families. And he was able to observe the interactions that were going on that unit for about 6 months. And he saw that it was almost like a mutual shaping process. He saw that reciprocal functioning that was going on between, quote unquote, the patient, but also the family members. And that was something that no one had ever done before. Next slide, please. And so when we're looking at applying natural systems theory to everyday life, it goes beyond the therapy session, the clinical room. You know, you can apply this to any organization where there are a group of people together. It really, if you apply systems thinking, if you apply natural systems thinking, you know, you could step in and even be a consultant for businesses and organizations. But the theory behind it is, you know, a change in one person's functioning is predictably followed by reciprocal changes in the functioning of others. So any change will then have a domino effect on how other people will change their behavior. And sometimes behavior doesn't have to be drastically changed. You know, you can just tell someone, you know, just slow down a little bit. If you slow down a little bit, then other people will speed up a little bit or have an opportunity to catch up with you. So it's really looking at that reciprocity that Bowen talked about. He talked a lot about anxiety. He talked a lot about anxiety, first of all, is normal. If we don't have it, we're dead, because anxiety is what keeps us alive. It keeps us, all our hormones, alive. So he believed that we inherit a certain degree of chronic anxiety down the generational tree. And so if you have a high degree of chronic anxiety, you're going to approach life with crisis-driven focus or a crisis-driven perspective or way of responding and formulating solutions. So the whole idea is to how can we get family members to differentiate better, that they can work on reducing their chronic anxiety so that the acute anxieties are day-to-day stressors. How can we just handle the day-to-day stressors without going into a crisis mode? So the higher the chronic anxiety, just to make it simple, this is Bowen for Beginners, the higher the chronic anxiety, the more symptomatic a person can be. So if we can treat that, and if we can treat the family members around the person that is the most hypersensitive in the family to be the symptom bearer, that person then becomes sort of like the sacrificial lamb without knowing it. And families do it really unconsciously. It's nothing nefarious or malicious at all. But it's an anxiety binder. And what it does is it allows a family to stabilize and function well. And so all that anxiety, there's one person that then is the receptor for this anxiety. So the therapy comes in as therapists, as neutral. So you step into the treatment room and you try to give a very calm milieu, a very therapeutic, neutral milieu to see how you can bring the anxiety down from the family, because we really want our families, our partners, our couples, or individuals, whoever you're working with, we want them to be able to hear and listen. And remember, when you're anxious, you're not hearing, you're only hearing the noise in your head. And so, because the anxiety is so much, and I always tell the students, you know, no one, when they're anxious, is going to crave lettuce. They're not going to crave a salad. If you're going to prepare to do change, you can't do it when you're stressed out. You have to be calm. And so sometimes it may take, depends on the level of anxiety of the client, 3 sessions, maybe 6 sessions, just to bring down that so they can ready now to listen to you and they can be more cognitive. So when we're looking at that anxiety of the family members, you know, that whole emotional connectedness that comes in, there can be a tendency more for togetherness and enmeshment, a fusion of everybody thinking and feeling with each other more than a thinking of self. And so we want people to start thinking of self Next slide, please. So if one or more members feels overwhelmed or isolated or out of control, these are going to be the people that are going to do the most accommodating. So again, take a look at your own family of origin and take a look at what is your role. And I always like to do a simple experiment in the class. I always like to ask the students, how many of you here are firstborn? How many firstborns are here? How many of you are an only child? And how many of you have a sibling that's at least, 5 years older or younger than you are? And, usually the accuracy is amazing. Sometimes it's 98 or 99% accurate of how many firstborns become therapists, because firstborns enter the helping professions. They go into law, they go into medicine, they go into nursing, they become clinicians, they do clinical work. So we all have a tendency, I'm a firstborn, and we all have a tendency, classic overfunctioner over here, but we have a tendency to do more than what we're supposed to be doing, but we also run the risk of getting sick. So your firstborns are usually, we take a look at the firstborns just to see, how they're managing that anxiety. And for some reason, you can be a firstborn being second or third if you stepped up to the plate, because maybe you had an older sibling who refused that position of firstborn. A lot of older siblings checked out creatively. They did whatever they wanted to do. They did not want to take that responsibility. And so you became the firstborn in the family system. Only children are very interesting because the only child depends on how they were raised. Was that only child raised to be the eldest? Or was that only child raised to be the baby of the family? So not all only children go into the helping profession. It depends on their role. So as Bowenians, we're supposed to talk about our family of origin just to put things in perspective. So, my mother and father, my father was a classic overfunctioner, and he was the youngest. He had 2 older sisters. I called him the menopausal birth. He was really unplanned. It was a huge age difference between him and his older sisters. He became, and the only boy, but he became really a firstborn and an only child all over again. He meets my mother, who was an only child to begin with, and they get together. And so what happened was, you had 2 only children that were cuddled, but one had to step up to the plate and not be the baby or the person that one was going to take care of. So my father stepped up to the plate, and he became then the eldest functioning in that relationship with my mother. So it's interesting to see that. And so when you're looking at couples, it's interesting to see how 2 firstborns come together, and it could be competitive, but in the end, Bowen called it a seesaw effect. Who's going to cede a little bit of power? Who's really going to step up? Now, higher functioning individuals, it's going to be very hard to see that. You might see those severe differences if you're much lower in the functioning scale. So we also want to be careful also with, in relationships, the person that does most of the accommodating, and especially in couples, we want to always assess who is eclipsing whom. And gender has nothing to do with it at all. There is a lot of female partner dominated systems, equal, as well as male partner dominated systems. And it goes again across the board for cross-sex and same-sex relationships as well. So gender really doesn't have anything to do with it. It just has to do with, again, your family of origin, And did you come from a family system that maybe was more mother dominated, or was it more father dominated in that sense? So we look at that eclipse. And what Bowen would do is Bowen would assess the degree of the eclipse. Is it 25%? Is it 35? Is it 50? Is it 75? Is it a total eclipse? And so one of the things that you want to see is that person that is completely being eclipsed by their partner is going to get sick. They will be the symptom bearer because they're the ones that are absorbing and accommodating to the needs of this person, this need for this person to control. Now, we're not talking about intimate partner violence or anything like that. We're just talking about, and that's another discussion. It goes beyond the scope of Bowen for beginners, but we're really talking about the need for someone to impose their values onto someone else and have them think and feel the way that they do. Next slide, please. So it's a nice little photo that my TA did. You know, I wanted her to put some pretty photos there, because sometimes the material can be quite dry. I'm going to try to make it as interesting as possible. Next slide, please. And so when we're looking at the core assumption of the emotional system, that it has evolved over several years, okay, into the relationship system. And so when we're talking about our prefrontal lobe cortex, our thinking brain, this part of our brain is what distinguishes us from the lower animals in the animal kingdom, because it has given us language. And with language, it has given us culture and religion and a whole bunch of rules and regulations. And with it, then, we are constantly in conflict with our old brain, the old part of the brain, and the limbic system. It's constantly in conflict. And so whenever we have an event that came through, let's use COVID, for example. How many people rushed and bought all kinds of paper supplies? That was the limbic system operating. In that sense, it was a knee-jerk reaction. And so one of the things that we always want to get our clients to do is stop, take a deep breath and pause. Give your prefrontal lobe cortex a chance to catch up to the limbic system, because that part of the brain is ancient and this part of the brain is not, and it's still evolving. And this is what gets us into trouble. This is what gets us to premeditate things. This is what gets us to fill up our refrigerators and 2 and 3 with food, because God forbid, should we starve? That's part of that anxiety. So in that, it really complicates things on how people are going to relate, rules and regulations. So the higher the chronic anxiety, the less of the self family members can be together, the more they are going to hold on to rituals and tradition. So when we're looking at culture, I know that that's a really big thing. It's postmodern language. But Bowen saw culture as just another form of an anxiety binder. And so during nodal events, we express our culture more exaggerated than ever, right? The rituals, right? Marriages, commitment ceremonies, deaths, the birth of the first child, all of the other events that come through. You may not be a religious person, but by golly, if there's a family member that is dead, all of a sudden everybody is pulling out the books and they're asking each other, okay, what do we do? How do we handle this? What's the rule? What's the process? And so that's their way of managing the anxiety. So pay attention to that within your own family of origin. You may not be religious, but during certain times, everybody's trying to follow the protocol, and culture as well when folks are anxious. We can go to the next slide. Let's see, and we can skip that one as well. I covered that. Okay, let's look at these 8 interlocking concepts. And one of the things that's really important, the key word here is interlocking, because one cannot discuss one concept without all the other ones. They're all related. So when we're looking at triangles, every dyad is considered unstable. Any relationship of 2 people, a dyad, is an unstable unit. And so we all need triangles to stabilize the instability of a dyad. So I just want you to know that triangles are not good or bad. They are inherent in all systems. Now, the form of triangulation that we use, we can see if it's working or not. So triangles sometimes are used to bring closeness to family members, or sometimes triangles are used to create distance. And so that is something for you to assess, as how is this triangle used? Triangles can also be living systems. They can be other people. They can be interlocking, depending on the degree of chronic anxiety. The higher the chronic anxiety, the more triangles you need to stabilize yourself and your relationship. We know that. But triangles can be inanimate objects as well. And so here in the United States, you know, one of the questions that people ask always, anywhere you go, is what do you do profession-wise? It's something that is done here. And we identify by our profession, by our career, and we justify all the work that we do and the countless hours that we do that, but we never think what a powerful triangle our careers are and how we use them to perhaps create emotional distance. We don't know, but it's very legitimate. And so that's something to think about. So those of us that, whatever we do in our lives, see how we use our triangles. I know couples, they're up at, I don't know, 3 or 4 in the morning and everybody's at the gym and everybody's exercising. That's a very powerful triangle for couples to do, which means that they're not spending a lot of time in intimacy. They're using now health and fitness as a way to stabilize this unstable dyad and add legitimacy, because this is something healthy. This is something good for us. And the same thing with the most powerful triangle is the birth of the first child, your firstborn. And I'll get to that later on when we talk about the fantasy system of the firstborn. So think of powerful triangles: alcohol, prescription medication, and recreational, work, exercise, school. How many students are professional students? They finish one program, they go to another one. They finish this one, they do something else. It's constantly. Those are very powerful triangles as well that we want to look at. And then, of course, the concept of differentiation of self is how can we help clients increase that sense of self? In traditional psychology, you may have been familiar with the term, how do you individuate? It's the same thing. How do you become a self? Well, it's very normal and healthy for children and adolescents to differentiate and challenge their parents, their primary caregivers. So please, for the audience, if I use parents, I also mean whoever the primary caregivers are in the family system. It's very natural and normal for children and adolescents to do that, to become individuals. Whether they come home and they shave their hair or they put on tattoos or piercings or whatever's going on, it's their way of trying to be an individual. It's their way of standing apart from from the Play-Doh, from that emotional glob that we can see that. So the degree of differentiation that the family has depends on the tolerance of allowing their family members to become separate selves. So in Bowen therapy, how do you differentiate and still stay emotionally connected to your loved ones? And your loved ones are those that really know how to push your buttons, the ones that can really trigger you. So in order to differentiate, you can't run away from home. You can't separate or divorce. You can't go off to college 1,000 miles away. Because that's not differentiating. You have to stay in the thick of things And how can you become a self? And I'll cover that later on tonight. And then we're looking at the whole nuclear family emotional system of how that family manages their anxiety. Some families do a really great job through they're bodily focused, or they have chronic conditions. So they either have social conditions of alcohol or gambling or inability to follow the law. Emotional illnesses that could fall under some of your psychological, psychiatric disturbances. And then the physical are your medical conditions, you know, whether you have hypertension or diabetes or things like that. Then the family projection process is, you know, how does that family project on to this anxiety onto their offspring? And so one of the things, and I think Anna Lynn, Dr. Schuler, you did a wonderful job when you came into my class. The students loved it because a lot of the students work with individually with children and adolescents. And one of the things that I've always told them is don't do that, because all you're doing is doing more of the same. You are reinforcing that family projection process. And we don't do that in family therapy. We don't do that in systems thinking. We don't shine the light on the identified patient. So treating children individually, adolescents individually, is you're sending a message to the other family members that, yes, I totally agree with you. There is something wrong with her. There is something wrong with him. I'll take care of it. No, that's not what we do. We turn off that spotlight. Have you ever gone to experimental theater in a play? I did that once. It was interesting. They turned off the lights on the stage, and they turned on the overhead lights in the audience, and then we were on stage. So if you can remember that that's really what we should be doing, turning the light off of the identified patient and shining the light on all the family members that are pointing the finger at the IP. And then the multi-generational transmission process, it is what it is. That's another thing that I love about Bowen. Things are not good or bad, they just are. We cannot control our genes. We cannot control what we have inherited. We cannot control what was passed down that generational tree. We haven't invented the instrument yet, but we know that we have emotional DNA. We just can't see it yet. So when we're looking at that whole DNA, I also want you to think about that whole emotional component as well. What is it that we have inherited? And it was fascinating to hear my mother tell me later on. I would say things and she would look at me and she would say, oh my God, you sound just like my father, my grandfather. But I was a very little girl when he died. So we didn't really have too much of adult conversation, but yet I inherited his philosophy and his way of seeing the world and the universe, which was fascinating. So how did that happen? If that conversation never took place, it's amazing. And then emotional cutoff, the higher degree of the chronic anxiety, the less differentiation a person has, the more drastic the emotional cutoff will be. So cutoff also can be used to heal oneself, to run away from family members that are making you sick. I worked with someone once, and this person came from a very, very abusive family of origin. And in order to rescue him or herself, they had to run away. They had to get away. And so the student was very, very concerned about that. And I said, no, you did what you needed to do. That's called survival. That's survival. So now you don't have to repair the cutoff, but it sounds to me like you're still carrying that emotional baggage. What could you do instead? How about writing a letter? So we can repair emotional cutoffs sometimes with just writing a letter. You don't even have to send it to anybody. That letter is for you, for healing purposes. So when we're talking about the postmodern approaches of narrative therapy and letter writing, well, the Bowens were doing it already. Margaret Hall, if you ever get an opportunity to read her book, she's really big on letter writing across the transatlantic. She lives in the UK. And I remember this was before WhatsApp and emails and all of that. People actually wrote letters, and it went off across the oceans, and eventually people received them, and then hopefully they would write back to you. So repairing emotional cutoff isn't like, oh, gee, I'm going to go see my family now for Thanksgiving and everything's going to be fine. No, it's not. This is something that takes time. The longer the cutoff, the longer it is to repair it, and the more drastic it is. So when we're looking at fusion versus cutoff, always remember that when people are magnets and they fuse together immediately, watch out. That's a clinical red flag, because they're going to go and separate just as drastic. So I always tell people, don't love me too much, because you bring me down from the pedestal and it's going to hurt when you bring me down. So I like to be always in lukewarm waters, tepid waters, not too hot, not too cold. And we can navigate that, because there's a lot of pressure in that fusion. And then the sibling position, which I love so much, and I talked a little bit about it already, so I'm going to move on. And then Bowen, so the sibling position, Bowen gave Walter Tolman a lot of credit, because Tolman did a huge body of research, and he wrote a book called Family Constellations, and he did all of this sibling research and sibling pairing and all of this, and he came up with some complementary relationships for partners to have. And of course, you have to also understand he was a person of his time, so he paired off heterosexual relationships of the oldest son that marries a youngest daughter, in that sense. But you can apply it to all types of couples in that. And then his most recent concept that he came up with was, I love this one, was the societal emotional process, the regression of how, as we move forward, we also drastically take a quantum leap backwards. And I remembered that Chris Burnett at Nova, it was during a tumultuous time with 9/11. And I remembered when he lectured on that, and I have to give him full credit for that. And he talked that 9/11 was nothing more than a triangle. And really, when we stop to think about it, that triangle was Judaism, Christianity, and Islam. That's really what it was. It was an eye-opener for me, because we were all very, very anxious. I don't know about you, but having to cross at 8:36 and look at that Miami International Airport and say, good God, I cannot believe that this has happened here, was very anxious at that moment. But when you're able to take this Bowen concept of something that was so catastrophic for it changed a lot of us, and look at it in the form of a triangle. And for the very first time historically, remember that in a triangle, two entities will come together and one person will be on the out. Always remember that. Who do you think came together? Who of those two entities joined against the other? Any guesses? For the very first time, Jews and Christians aligned themselves against the enemy, the other. And that was a powerful triangle. And then the United States went through the honeymoon phase. I don't know about all of you, but I never saw so many American flags in all my life, and all the cars and everything. And the honeymoon phase lasted how long? Because then all of a sudden the flags flew off, and then they littered the highway. Nobody thought about recycling, and nobody thought about and then the flags were trashed. You're not supposed to do that. There's a proper burial for the flag and all of that, but nobody was paying attention to any of that. And so that honeymoon phase of patriotism lasted 6 months maybe at the most? I don't see any more flags on cars. I don't at all. So we also have to take a look at how that togetherness came together during an anxious moment. We can go to the next slide. All right, so I covered this. This is a direct quote from Kerr and Bowen, and it's a wonderful book. Actually, I brought it. I can show it. The family evaluation. I don't know if you can all see it. It's wonderful. One of the things that we like to teach our clients is we encourage them to get the book. We encourage them to read it, because one of the things that the Bowen people do at Georgetown is they open up their knowledge to the community, and they have lectures, because we believe that the more we can educate people in very simple language, we can have a healthier community. That's really all it is. We don't keep anything secret. There's no secrets. I know that there's other theories that aren't as transparent. No, of course, not the family therapy ones, that. But so we are very, very transparent in what we do, and we really are. He never called himself a psychiatrist or a doctor or a therapist. He always called himself a coach. He always said he was a family coach. And that's what he always called himself. And if you really think about the work that we do, we are all coaches at the end of the day. That's really what we do. And therapy is about teaching and helping clients change. And that's really what it's all about. So he always said that a triangle is the basic molecule of an emotional system. It is the smallest stable relationship unit. That's a direct quote from Family Evaluation. And they're reflective. So whenever there's a knee-jerk reaction that happens, one is going to triangulate. A simple example. You have an argument with your partner. You storm out of the house. You have a cell phone, because everybody has nowadays. You get in the car. And you're going to call someone, aren't you? You're going to blow off steam. You have to call someone. You're so anxious. So it depends on who you're going to call. Do you call, I don't know, a trusted sibling, a trusted parent? You call your best friend. You're going to do something. So right there, ladies and gentlemen, that's a triangle. You were anxious at that moment. You triangulated someone to help you manage your anxiety. The two of you came together against your partner. Now, what happens with that triangle is that you don't tell your friend that later on you went home and you kissed and you made up and everything is fine now. So the next time that your mother or your sister or your family member, your best friend comes over, they're going to look at your partner and they're going to give that partner dirty looks, because you dumped a lot of anxiety on them. And you didn't tell them that everything is okay, but you feel great now because you dumped at that moment. So again, it's a simple example of, a triangle at that moment. Now, if the anxiety is so high, and let's say you dumped on your mother, for example, let's do that, making it a little bit more triggering. And then all of a sudden, your mother's fit to be tied because she never approved of your relationship with your partner. And so now you have just given your mother a lot of ammunition. So now she's going to call in the troops, and she's going to tell everybody what a terrible person your partner is, right? And so now what has she done? You gave her so much anxiety that she ran with it. You were the anxiety generator. And your mother became the anxiety amplifier. And now all of a sudden, she did all of these interlocking triangles because her anxiety was so high. And she wanted to win this battle with her daughter. And she wanted to really prove to her daughter, I told you so, but not so much in that way. So this is an example of an interlocking triangle at that moment. So you want to be careful who you triangulate with. Because you never wanted to come back at you or with your partner or whoever in your relationship is at that moment. I think we can go to the next slide. And triangles will always define the facts and functioning. So again, we will use triangles over and over and over. Well, take a look at your own family of origin. Take a look at what are the triangles? What are your go-to triangles? What's your comfort? We all have comfort food, right? What are your comfort triangles that you go to? And you know that every time you're anxious, you know how you're going to engage in that. And then what happens if your go-to triangle is not available right now? I have a very, very dear friend who's out on a cruise for the last 2 weeks. How dare he do something like that when I need him now during this most anxious time of October? Yeah, so I've had to manage my anxiety in a very different way because that's my go-to triangle, is to call. So find out what your go-to triangles are. Or, did you have a best friend and now your best friend is no longer available because now your best friend is in a relationship or moved away or whatever. So what are your substitute triangles now that you have? And triangles will always describe the who, what, where, and when of a relationship, never the why. The why will always give us a cause and effect. So we always want to look at the facts of functioning. Always think of yourself as a really, really good, unbiased journalist. Make sure that the journalism is unbiased. And just report facts of functioning without any emotionality attached to it. Next slide. Now, here are some powerful triangles that I wanted to spend some time with. And I'm going to start really with the mother-in-law triangle. So in couples, that is the most powerful triangle that exists. It is the mother-in-law. It is in the relationship of men and women. It is the husband's mother is the most powerful triangle that will exist. And usually in these relationships, somehow men find women, and women volunteer. They sign up for the gig to do battle with their mother, with his mother. They agree, they sign up for it. They're ready to do it. And so one of the things that we do in Bowen therapy is we get the son, the adult son, to go back home and differentiate. But they always find women that they can go behind, that they can then do the battle. So always keep that in mind. And then, of course, we have, again, the birth of the first child, the mother, father, child is a very powerful triangle because you have to understand that that's based on the fantasy system, that whole system of what child am I going to have and what name am I going to give my child and all the wonderful things. And my child is going to be this incredible scientist, et cetera, et cetera, et cetera. That's all in the fantasy system. And then, of course, trouble starts when you see your fantasy system not being materialized. So again, part of psychotherapy, part of the work is how can we get clients to distinguish between what is fantasy and what's the reality system. And that takes a lot when we're doing work with family of origin. Maybe we're doing work with our parents. Maybe how do we teach adult children to accept your parents for who they are and not the parents that you wanted them to be? How can you get a client to accept his or her partner just the way he or she is and not the way that you want them? There's a great play that went on New York Broadway. This was already quite a few years back. And it was sort of like, hello, I love you, let's get married and now change. And so sometimes we fall in love with the potential. We don't ever fall in love with the person. We fall in love with a project. And then what happens when that project is completed? Do we go off to another project? I don't know. That's something to think about. Or do we constantly need a project? And then again, the one that I mentioned of the wife and the best friend, and then the partner. So these are some very, very frequently observed triangles that are very, very powerful. And like I mentioned before, these are the other elements too: career, alcohol, pets are great. I don't know if you've ever heard of Philip Garen. He wrote the book of the 1, 2, 3s of triangles, and he's Bowenian. And he talked about when, in one of his webcast series, he talked about when my wife went back to graduate school, I adopted a dog. So he talks about how he used the pet as a triangle because his wife was away. And so he needed that. I think we can go to the next slide. So, and we can skip that one too, because I covered that. And another photo, thanks to Nicole. And then we're looking at the multi-generational transmission process. We're looking at differences in functioning. And so really some of the things that you can do is you can take an average assessment of the degree of differentiation that a family has. And so what you want to do is you also want to take an individual assessment of the differentiation of each family member. And then what you want to do is you want to eliminate the highest functioning family member from that equation. And then take a look at the degree of functioning that the family has. Because usually the person that has the highest degree of differentiation is usually the person that says, gee, there's something wrong here. I think I want to go see a therapist. And so Bowenians believe that that's the person that you want to work with, because that's the person that can elevate the leader of the family tribe, can elevate the differentiation of the family members. And so sometimes that's always helpful. For one, I know that the MRI people would always want to work with the complainer, the person that really realized that they want to do something and willing to do anything to have that change happen. And so really, whoever initiates that phone call is something voluntarily, not court mandated. But it's always interesting to really take a look, because that's the person that's really motivated to really make some differences and some changes. And we don't change people. Therapy is about how does one stay in a relationship and how does one change one's reactivity to the fact that family members are not going to change. And remember, let's go back to the beginning of tonight, is, a change in your functioning will have reciprocal changes throughout. So if I become non-reactive, thanks to my family coach, then family members are going to have to change, because I was not reactive. We have a saying in Spanish, you know how fish die? They die through the mouth, by the mouth. Don't bite the bait. Make sure that you don't open your mouth and bite the bait. Just stay quiet and stay non-reactive, and you will see that there will be changes in that family system by your non-reactivity. I think we can go to the next slide. And so, of course, we always want to see how many people we can add on to the family diagram, the genogram. That's always helpful. Bowen did a wonderful experiment. He would give a 3-generational genogram to the medical residents, and he would say, okay, I want you to come back and give me some hypothesis and take a look and give me some diagnoses over here. And based on that 3-generational genogram, the medical residents were able to come up and use it as a diagnostic tool. It was just so accurate. I had my students, when they were working in the graduate program, and they had to provide services to survivors of violence, domestic violence, family violence, intimate partner violence, and I had them all doing family diagrams. And it was so remarkable how the clients would have this aha moment, and you color code it. It's a learned behavior. They saw it going down the generational tree. They saw it in the other partner as well. So it's fascinating when we're talking about violence, it's fascinating how we have two people come together, because it's based on their family of origin. And we look at this in terms of shaping, and we're looking at it as a complementary relationship when you're thinking about it, because how did these two people come together? It was based on, again, their family history. I always use an example. I don't know how old I was. I was really very young, and I don't know. I was playing tennis with this kid and whatever, and I don't know. I must have been, I don't know, 10 or 11 years old. And back then, you know how they said going steady and all of that. And he wanted to give me a going steady ring. And we were up on the rocket in the park and all of this. And then like, I didn't really care. I was very naive. And I said, okay, sure. You know, I just wanted to play tennis and run. And then he comes out and he starts giving me all of these rules. Well, but you can't come to the park alone, and you can't wear those shorts, and you can't do this, and you can't do this. And I looked at him and I said, oh my goodness. I took the ring and I threw it at him. I said, guess what? We just broke up. And I went down the slide and I ran home. And I always tell, I ran home. My mother and my father were there. And guess who I called out to? Any guesses? I called out to my father. I said, Daddy, 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 look what just happened to me. And my father said, you know, a couple of choice words. He said, you did the right thing, kid. You don't need that SOB. And so that's why I didn't have it in my family of origin to be attracted to someone that had power and control. So it's fascinating. As a young, now what happens if my father would have had a different response to me? Things would have been very, very different. So again, take a look at your own family of origin, you know. And he told me that what I did was right, that I did the right thing. And that was very important message at that moment. But I also knew that there was something wrong with this picture already as a young girl. But how many young girls and boys think it's normal because it's in your family history? So I just wanted to illustrate that point to make it as authentic as possible when we're talking about our family of origin. I think we can go to the next slide. And maybe what we want to look at, we can skip this one, and maybe we want to go maybe to the next. Yeah, we can skip that one as well. The function, okay, quantum leaps. Okay, so when we're looking at family functioning, we're looking at down the multi-generational tree, we're looking at maybe the next generation, there's a decrease in functioning, and then there's another decrease in functioning. So usually quantum leaps are not really seen. They're considered anomalies. I think maybe a quantum leap in functioning would be in the cases of autism, because this is something that's very, very new. Because if we look at the whole multi-generational transmission process, we don't see autism in the family tree. So that would be something to consider. But when we're looking at schizophrenia, it takes a series of generations to produce it. And we can see how that family in preceding generations, their functioning wasn't optimal. So I hope this is making sense for everyone. We can go to the next slide. And yes, it takes about 5 to 10 for the schizophrenia to develop. So if you want to look at an anomaly, the easiest way to remember this would be autism. We'll go to the next slide. And I covered this already, so we'll go to the next one. And more pretty photos. And we're looking at the gene level here, that we do inherit certain functioning on the gene level. So I always tell students, you know, you need to have a really good environment to grow good mold, right? You can't just grow mold unless you have a really good, rich environment. And so we all have genetic predispositions to a host of things, but it has to be under certain conditions that it can surface. And so when we're looking at anxiety, usually people get sick when there's anxious moments there. And so if we can, again, establish a calm milieu, that their symptoms can submerge again, that they can get maybe their hypertension under control, their blood pressure that's under control, maybe the rheumatoid arthritis under control. And that's why you'll find many Bowenians in the healthcare field. And you see that a lot. And I'm very pleased. I've known throughout the years many nurses and nurse practitioners that are also Bowenian. And I knew a medical doctor, she's since retired, And she was very fascinated with Bowen, and she did some additional training on her own at the Georgetown Center. And she would do genograms with her patients on there as she was practicing her medicine. So we can go to the next slide. So we're looking at the expression of certain genes that can always be governed by the emotional process. We know that there are certain eating disorders that one can inherit, certain nervous conditions that one can inherit as well, obsessiveness that one can inherit in terms of how is that being passed down the generational tree. And so then, what are the triggers in the environment? How can you take care of that? I've got students of mine that are working at some of the eating disordered facilities in town, we're looking at, and now they're so excited, Annalyn, when you did that presentation, they're so excited about the work that they're doing right now, where they really want to work with the families involved with their patients there at the eating disorder. So it's really interesting. We can go to the next slide. And then the differentiation here. So part of the Bowen therapy is that we don't like to have couples talk to each other. I know that some of the other family therapy models, they do that. They want to see an enactment and a videotape of what goes on at home. Well, in Bowen therapy, we don't do that. What we do is we will ask partner A, we will ask a question to partner A, and then I will turn to partner B and I will say, did you hear what your partner just said? And what are your thoughts on that? And then partner B would then answer me. And then I would turn around and I said, did you hear what your partner just said? And so we would keep that conversation going. So I would be the conduit. So when we're looking at therapists as beacon, therapists as the most neutral triangle as possible. And Bowen was very aware of his triggers in his family of origin. So you know what he used to do when he was coaching sessions? He would have the genogram, then the clipboard of the people that he was working with, but next to it, he had his own genogram as well, because he wanted to be mindful of where there could be pitfalls or triggers going on. So he really wanted to have that visual. And that's why it's important for you to work on your family of origin. It's important for you to feel your own reactivity, because we're all triggered, we're all human. And so if you're working with a case and it's hitting too close to home, then you know that you need that supervision, that you can process that so that you can work through that transference and that countertransference. So it's not a negative, destructive one, and that you don't end up abandoning your client because you're the one that's triggered. And so it's important, really important for you to, we all have unfinished business in our family of origin. It's just to what degree are we managing it and how are we handling it through the life cycle events. So really when we're looking at psychotherapy, I mean, I'm looking at it as it's lifelong. You don't have to be in therapy every week, but you go in for tune-ups like you take care of your car. And so I like to see it as, going to see my coach every once in a while. I need a tune-up, at that moment. And so when we're looking at the three patterns of emotional functioning in the scale of differentiation, I had mentioned them earlier, but just to recap, you have the physical, which are the medical conditions. And then you have the emotional illnesses, and then you have the social illnesses that are there. Inability to follow law and order, alcoholism, gambling, etc. We can go to the next slide. And so how can we get our clients to think and not react is important. And how can you as a coach think and not react? And so when times are anxious, I tell the students, it's a good time to say it's time for a break. And go clear your head, go drink a glass of water, collect your thoughts, and then you can come back. And if you're feeling triggered, if you're feeling anxious of some sort, try to process and see, what is going on there. But and another thing too, we want to be very, very careful the words that we choose. We want to make sure that, most psychotherapy models, we have the client drowning in feelings. The client comes to us already drowning in feelings. And so, we're going to be very Shakespearean and take them over to the deep side of the lake and let me continue to drown you in feelings. You don't want to do that. You really want them to think. So never ask your client, how do you feel? What are your thoughts on this? And so we really want to stay away from feeling based, because that's important, because we want them to engage cognitively. We also don't want to use euphemisms when we talk about, we don't want to say someone passed on and there was a loss. You didn't lose your father, he's dead, he died. And so it's very important that we use correct words, because we really want to bring clients back to that reality system that's important for them. Now, I also want to just take a moment to share with all of you that the fall season is a wonderful time for Bowenians to work with clients, to tell people this is a great time of year to go back to your family of origin, because it's full of holidays, religious and secular, for you to, and remember, it's all based on the fantasy system with all the commercials and the nostalgia. And so when everybody's getting ready for the big meal coming up right around the corner, if you're celebrating it or not, it's all based on fantasy system. It's the most traveled day of the year in the United States. But we're all going with an expectation, right? We're all going that this time things are going to be perfect, aren't they? Uncle Harry is not going to get drunk, and Aunt Sally isn't going to ask you, when are you going to get married? And when am I going to have grandchildren? And no one's going to make a spectacle of themselves. And whatever you're serving on the table is going to be perfectly cooked according to the Publix commercial, as long as you shop for them. But it's all fantasy. And you know perfectly well that Uncle Harry will get drunk and Aunt Sally is going to bother you, and when are you going to get married, and when are you going to give me grandkids, et cetera, et cetera, et cetera. So we really want to coach clients during this time, prepare them for this event, and prepare them to go in there with eyes wide open and engage in that reality system. And it's a wonderful opportunity not to triangulate and to establish one-to-one relationships with your family members. So for some of you, if you've never been able to talk to one family member alone, because there's always a triangle, this is a wonderful opportunity. How can you establish a one-to-one with these family members? Is never more very important without the triangulation. And another thing that's very important is you need to assess. Remember, you can lie to the world, don't lie to yourself. You can assess, you must assess, can I be who I am with this family member? Can I be who I am with this family member? Or am I a chameleon? Or must I change? Must I change my colors according to who I'm engaging with in my family of origin or in my other relationship systems, in my families? So when we're looking at that chameleon effect, that chameleon is an animal that has to change colors in order to survive. So I want you to think, again, things are not good or bad. I just want you to think that if one has to be a chameleon with certain people, I want you to see it as a survival mechanism, a camouflage of how to survive. There's no pathology in any of this that I covered today. And if I came across that way, my apologies, because one of the things, we do not pathologize anything. All behavior functions within the family. I had a student earlier today talking about dysfunctionality and his family of origin. I said, within that dysfunctionality, your family functions very well, and you seem to do extremely well because you're here in this doctoral program. So your family did something well. And so we really want to, again, engage in that reframing and looking at those strengths, because that's very important. And we also like this season too, because of all the nodal events that come into the season and all the rituals, right? And all the cultures that come together and all the arguments over what family are we going to celebrate Thanksgiving and what day are we going to celebrate Christmas or Hanukkah or Kwanzaa or whatever you want to celebrate, or the full moon and the drumming. So it's important, and also to see in that time, are you being eclipsed by your partner? Or are you a refugee from your family of origin and you've been adopted into your partner's family system? And now you're put on a pedestal and you have to be a chameleon so you can be accepted. You cannot speak your mind because the day you do, you will be cut off. So we want to take a look at that. We also want to see who are the refugees, who are the runaways from one's family of origin. And now all of a sudden you fit that perfect sibling position in your partner's family. Maybe you're the daughter they always wanted to have. Maybe they have a daughter, but you're the perfect daughter. Or the son. So also that's a way of assessing things as well. I think we can go to the next slide. And I don't know how much time I have. This is Bowen for Beginners. I'm being mindful. So the highest level of differentiation, and really when we're looking at relationships right now in the product of evolution of us as Homo sapiens, right now, no fusion exists. There's no such thing as no fusion in intimate relationships. Like Dr. Kerr says, Mike says, you can have two high functioning individuals living parallel lives and everybody's life directed, but there's got to be some type of intersectionality in terms of togetherness and intimacy. And so that's something to look at. But the higher you are, the higher that you're differentiated, the more that you can be altruistic and you can look out for the welfare of others. And the more that you can remain asymptomatic during stressful events. Now, no one's immune to symptoms, but it will take a lot more to break you down in that sense. And maybe we want to look at this whole crisis and this whole pandemic that we're in right now and just be reflective. Take a look at, how did you respond? I know how I responded. March 2020, I turned that television off and I haven't turned it back on. That's how I do it. And I look at people, taking things off the shelves and everything like that. And I say, well, they're managing their anxiety somehow the best they can, So, and also the more of a self you are, the less you have to preach to others, the less that you have to tell people what to do. Just like Bowen said, don't do anything, just stand still. Allow the chaos to whirl around you, and eventually people will calm down and they will engage their thinking hat. But, it's hard to do. We were talking earlier about academia, and I joke around. I say, I have two professions, I'm a firefighter and I'm a sanitation worker, and so really when we're looking at that, I have to be very mindful of that role. And all of us, for firstborns, and we're here in the helping profession, I'm sure we're very good at putting out fires, right? And we're very good at cleaning things up and making everything look good. So we have to just, again, practice our self-care the best that we can. I think we can go to the next slide. And when you have a lower level of differentiation, you are going to regress to very selfish, aggressive methods. You're not going to look out for the welfare of others. You're going to be highly allergic. You're going to engage in avoidant behavior. And there's not going to be any cohesiveness or cooperation at that moment. Another thing, too, that you want to be careful is with groupthink, that whole herd mentality. And so again, the higher you are, the more you can really engage in discernment of, no, I don't want to be part of this herd mentality. But then you have to be very mindful for survival of, is this a really good time to say something, or am I safe just staying quiet? You have to use your judgment during these times they're pretty trying. Next slide, please. So the more you can be an individual while you're in emotional context. So really working on differentiation of self is considered the high road in psychotherapy for Bowen therapy is, and let me talk about two types of differentiation, which is important. You have your basic, your genuine differentiation, and then you have the pseudo functional. So we have to be careful because a lot of people think they're differentiating and they're not. They're only engaging in functional changes. So what are the functional changes? Career change, geographic moves or cures, divorces, or marriages, or getting together, whatever you want to call it, the birth of a child, anything that are functional changes that are going on. But those changes do not count. They don't go into the equation of what is that core basic self of who you are and what you believe in. You know, and Bowen talked about people that are very, very good at being conveyors of information, you know, but really when you ask them, really, what do you think and what do you believe? They can't answer that question. So ask yourselves, you know, what do I believe? Who am I? You know, where are these thoughts coming from? Do I agree with this? Do I not agree with this? So, you know, I think the more education that one has, the more that you can really look at all of the disciplines, all of the thoughts and everything. And if you're good, you can punch holes in just about everything. And that's discernment. You know, at that moment, you know, you're really discriminating rather than being very dogmatic and engaged in a closed system. So when we're looking at systems that are very, very closed systems, it's us against that world outside. You know, they run the risk of extinction and they can become very symptomatic. Systems that are open, remember that you can't have them too open. You have to allow some energy to come in, and you have to know when to close the door for safety reasons, in the sense if you're raising adolescent children, it has to be all age appropriate and developmentally wise, you know, how open the system is going to be, obviously. But when we're looking at the flexibility in a system, we always are looking for that when we're making an assessment. And so if we're working with a couple and the system is very, very close, I want to go to the next generation and I want to see, well, who are the rogue individuals? What did they do? What was different in your ancestors? Who did what that was interesting, that was different, and their attempt? It shows flexibility in the system. We always want to show flexibility. Now, a healthy system has a little bit of all three, you know, a little bit of marital conflict, you know, a little bit of social illnesses, you know, a little bit of something. The systems that are harder to treat are everybody's okay, except you have one person that has a chronic medical condition. So those are very difficult to treat. So we really want to look at families also that know how to take turns getting sick. We show flexibility. Oh, it's fascinating to watch. They're just waiting for their turn to get sick. They know that they have to maintain their symptoms at this moment. And then they know when it's time for them to do it. So always take a look at that. So a couple of levels of assessment that you can always look at. Who is the anxiety generator? And who is the anxiety amplifier? And who is the anxiety dampener? And that's very important always to make those assessments when you're looking at it within your own family of origin. Take a look at that. I bet you all of us in this room are the anxiety dampeners, right? We're the firefighters. We know how to put them out. Oh, California just doesn't know what they're missing. We have to go over there. We can take care of that problem in a heartbeat because we're in this profession. This is what we do. Another point of assessment always is take a look at who's in charge, who wants to be in charge, who does not want to be in charge. And we look at that with the family in terms of there's many parents that they don't want to be in charge and they let their kids be in charge until one day they decide that they want to be in charge. Well, it's too late. When did you give your power away? Let's do a timeline. 7 years old, he threw a fit at the grocery store. That's when you started to give your power away. He's 16 going on 17. What do you want to do now? Be a parent? No, let's see how we can work this whole year that he turns 18. How are you going to survive? So, you know, again, this is the best that we can do with what we have. But it's always good to see who's generating the anxiety in that moment and then who's echoing it. I think we can go to the next. Oh, so it's also very important that we want to make sure that we don't work to help somebody differentiate at the expense of others in the family system. So we really want to make sure that I cannot increase my functioning at the expense of other family members. So we want to make sure that my level of functioning isn't undermining functioning of other people. That's very, very important. We have to be very mindful of that in that sense.
Can you give an example of that, Dr. Irma?
Sure, very simple. You have a woman, she wants to go back to law school, and she wants to, but she also wants to spend more time with her son. And so really, how are we going to look at that? How are we going to work on her wanting to better herself? She wants to go to law school, which is admirable. She's going to go to night school, but she also wants to spend more time with her child. And so her attempt to individuate is going to be at the expense of not neglect, but the expense of she's not going to be around. So who's going to take care of her son? So that's an example. Another example could be in two adult relationships, two partners, where I'm going to go get a second job because I want to buy a fancier car, not because we need to put food on the table. That's very different, but because I want something luxurious or whatever it is. And so, so I'm going to go off there, but at the same token, now my partner has to pick up all the slack in the house. And so that would be a way of impinging my need for differentiation or my absence in the house in that sense. I don't know if I've answered your question.
No, that did help. That did help. And I can see there's no simple answer in that.
No.
Yeah, because inevitably, if one is going to individuate more or differentiate more, it is going to be at somebody's expense at least a little bit.
Correct.
So yeah, I understand. So I'm looking at the time. We've been running for almost an hour and a half, and we're on slide 28 of 91. I think we might need a part 2.
I think we may need a part 2.
We may need to schedule in a part 2. So we'll figure out exactly when that will be. I might convince you to do it in December so that we don't lose the momentum. But this has been absolutely fascinating. Let's open it up to the rest of the group for any questions about anything that they have so far. And we'll book a part 2 to get on with the rest of the slides. So anyone have any questions about the topics that we've talked about already tonight? Oh, now come on, don't fail me here. I've stopped her to do that. All right. Richard Long wants to know about the question about autism and that being a quantum leap.
Right. So when we're looking at the family system, when there's the birth of a child that's born with autism, in some cases even twins, or I know of one particular case that both the twins came down with autism, then Bowen would call that a quantum leap in regression of the family, because historically in previous generations, family functioned high and well. And really when we're looking at the parents, the biological parents in this case, not the adopted parents, biological parents that don't have any symptoms. And then all of a sudden everything is fine, except they have now a child that's born with autism.
So an autistic child is such a high level of anxiety producing issues that whereas maybe multiple generations, we have an immigrant whose son became a businessman, whose son became an attorney, and then who then became a judge, and then we have a family with autism, and it sort of pulls that progression back. Am I close?
You're spot on, Anna Lynn. That's exactly what it is. And so that's why Bowen, still today, we don't have an explanation for it. We have a lot of hypotheses, they're ruling it out, but it's something that's really interesting in terms of when we're looking at chronic mental illness, like schizophrenia, for example, we can see how that family progressively deteriorated in functioning. Richard, I hope I answered your question. Yeah.
Cool. Since Bowen is a modern model, meaning as opposed to postmodern, how does it approach the influence of the therapist? Oh, I know the answer, but I'm going to let Irma say.
Well, I'm trying to understand the influence of the therapist, meaning my presence in the system. So it's coming in, obviously, when people come to see a Bowenian coach, they're looking for someone that's going to guide them and help them in the system. So I'm the observer in the family, but also I know that I'm very much part of that family system because I also serve as a role model, and I engage in what is called appropriate self-disclosure, like what Bowen did. Even though he was from the modern camp, he came from psychiatry, from psychoanalytic thinking. But you know what it is that he put his genogram on a clipboard next to his clients. That was pretty amazing what he did. And
he's so self-reflective. Yeah.
Very
self-reflective. Therefore, he took less of an expert role by virtue of reminding himself that that what's happening in the client family in front of him is engaging his own differentiation, togetherness versus individuation, all of those kinds of things. Yeah.
Correct. And actually, when I look at my colleagues, and they're very, very good about talking about that. And they go, well, I don't know how it happens in other families. I don't know if this is good or bad in your family, but what are your thoughts on this? What's working for you? What's not working? So again, coming in from a non-pathological lens in that sense. And I don't know if all of you've noticed how deliberately I talked about my family of origin, because that's part of what we're supposed to do when we're talking about this. We're supposed to put things in very matter of fact perspective, and again, the appropriate self-disclosure.
Would this idea also be correct, Irma, that the family is going to engage with the therapist in the way they would other family members, i.e. triangulating or that kind of stuff? They're going to try to triangulate the therapist.
Oh,
and
definitely.
So we allow that to happen, but we maintain our differentiation so that we don't amplify or dampen the anxiety.
Right.
And that we're this sort of neutral space so that they can throw their stuff against the wall, and we're not going to let any of that stick.
Right. And so we think we coin it as therapists as the neutral triangle, because the triangles are not neutral. So how do I engage in couples therapy? How do I let partner A know that I am on partner A's side and partner B at the same time? How to engage in that? How do I listen to the two of them? And the whole idea of that neutrality, that I'm the conduit, that I talk to them, they answer me. That whole reasoning behind it, I don't think I had a chance to explain it, is because partners are now going to hear their partner for the very first time. They're listening for the very first time instead of engaging in a dialogue. So it's fascinating. It's almost like eavesdropping,
So again, by having the couple speak, as you wrote it, Richard, through the therapist to kind of spoken hub with the therapist at the hub, that it keeps the two members of the couple from amplifying and or dampening that anxiety. If they do through the therapist, then they can't do what they usually do that doesn't work. And this is interesting because it's very reminiscent of the early stages of EFT, where the therapist is doing all the attunement, right? Is not asking them to try to attune to each other, that the therapist is doing all that attunement and keeping things at an even keel. Again, not dampening, but also not amplifying, which is what the couple tends to
Correct.
do. Am I on target?
You are really spot on. And also what's really important is you have to understand that what we really want to do is we want to bring down the temperature. That's our mission. We want to bring down the temperature. We want to bring down the heat. And we want to tone down the emotional reactivity. And we want them to hear each other from the very first time. So that's why it's so important for the Bowen coach to be calm, to just be very, very calm, serene as much as possible. And that requires you to do your own work as well at that moment. So it's a very calm thinking. I'm very mindful of the words that I use. I make sure that I don't use, and it doesn't mean that we're not empathic. It has nothing to do with that. Sometimes the Bowen therapy is misunderstood. It's not. We are very empathic. We're very much aware of the feelings, but the feelings is what got people in trouble to begin with. So why are we going to do more of the same? That's all it is.
So any of my students who watch this know that I'm famous for saying that I don't care what people feel. I'll empathize with it, but I won't ever ask them. I had no idea I was being Bowen when I said that.
You're being Bowen.
I had no idea. So, all right. Well, Amanda or Nelise, do you have a question for us? You can speak it. You don't have to stick it in chat if you don't want to. But if are there any more questions? No. All right. Well, oh wait, no questions. Good. All right. Well, Dr. Barron, thank you so much. This tonight has just kind of flowed out of you, and I so appreciate that. And we absolutely will book a part 2. I'm actually thrilled that we're going to get a part 2, and because we have so many more slides. We've got, I don't know, 60 more slides, and I've studied Bowen, not extensively, but this has been the most enlightening Bowen discussion I've ever had. So I'm so appreciate it, and I look forward to sharing this with everyone. Those of you who are in attendance, be sure to look for us in YouTube, and those of you who are listening on YouTube, look for part 2 in our YouTube channel. And thank you very much.